Dr. Mazloomdoost is an interventional pain specialist with years of training to bring the most modern evidence-based techniques to the treatment of pain-related conditions, whether acute or chronic. He also understands the challenges we currently face with the epidemic of opioid addiction and now opioid-related overdoses. He talks about the transition in pain management and what started as the compassionate treatment and cancer care to a nationwide epidemic.
So I think if you go back about 20, 30 years, there was a large movement to address pain at the end of life. And somewhere along the way, that got transformed into pain at any point of life. And it became an overextension of what realistically medicine can accomplish. Because when you transform medications that are utilized for acute care into medications that are used on a daily basis, you start to lose its effect, and moreover, it starts to create other problems from a neurophysiologic standpoint that are irreversible and become very difficult to treat. In fact, if anything, the pain medications will potentiate and make the pain worse as time goes on. So it becomes a matter of understanding how to treat the pain appropriately rather than just kind of quieting the symptoms and waiting for it to progress further.
And with that came the opioid-based pain medications.
I don't think it started out as a nefarious endeavor. In fact, if anything, I think the opioid crisis is a perfect example of the road that's paved with good intentions. I think anybody who sees somebody that they care about enduring pain, they're by all means going to be, they're going to have a desire to do something about it, arrest it as quickly as possible. It's very difficult to endure pain. It's very difficult to watch somebody you love enduring pain. And so what began as, well, these are tools that work immediately and get people out of pain, it just kind of evolved from there, where people just kept using that over and over. And there developed a level of complacency about what's causing that pain. A lot of advocacy groups developed. I think there were a lot of special interests, like pharmaceutical industry, that saw this as a big cash cow. I mean, hydrocodone is the #1 prescribed drug in America. It exceeds medications that are used for essential hypertension, which is among the most common diagnoses in the country. So the fact that this became such a huge industry kind of self-perpetuated itself and became a self-fulfilling prophecy. The more pain medicine you write for, the more pain medicine patients crave, and it just keeps growing.
The problem is that opioids overall are a poor option for anything other than acute painful conditions. Dr. Mazloomdoost fills us in on how opioids can be more of a problem than a solution.
The bigger concerns that I have with opioids, or that's panned out in research, is one is the tolerance that develops. The tachyphylaxis is what they call it. You gradually adapt to the presence of that opioid so that it doesn't really affect your pain anymore. The first time somebody takes a pain medicine, they feel amazing. And then a year from that point, they're not feeling the effects as much. And then 5 years from that point, they're not able to live a normal life without the presence of that pain medicine. That's one of the biggest concerns. The second is there's a contradictory effect from opioids. When you first take it, you get, if say for instance your pain is starting at this level, when you first take it, it's going to drop it down. But as that pain starts to come back, or as the medicine starts to wear off rather, your pain doesn't rest back at the starting point. It actually rebounds to a higher level of pain. And it takes much, much longer for that to realign with your previous pain state. Now, if it's an acute pain issue where you expect that the peak in your pain corresponds with the duration of action of the medication, then that rebound effect kind of balances things out. But when you're dealing with a chronic pain, if you're constantly fighting this swing, it's a whole lot harder to deal with pain when you're going from these really good times and to really, really bad times. Moreover, any effort to try to keep people at this level is just going to shift the whole scale up, so that your pain relief is potentially even higher than what you would have been had you never started pain medications.
The key for pain management, especially chronic pain, is understanding and addressing the source.
So the way we go about things is we try to peel back some of the layers, develop appropriate expectations of what pain management is, what that life will cause pain, that you will have painful issues as you age, and that our job isn't to eliminate those, it's rather to try to keep you as healthy as possible and to undo some of the damage that is causing pain. Generally speaking, pain it's like your check engine light. It's not a disease. It's something that your body actually utilizes to notify you when something is not working correctly. And we got to understand what's not working correctly and how to best address that.
At Pain Management Medicine, they utilize tools to help diagnose the cause of painful conditions and then modern modalities to treat the source.
Generally speaking, I take one of two roads with patients, and I explain this the first time I see them. There's a palliative road, which means that we're just simply trying to get you relief, and then there's a regenerative road, which is what we're trying to fix the problems that are causing the pain. And a lot of pain management has been focused heavily on the palliative road, just getting relief. And you can do that with reducing inflammation, with numbing nerves, or even ablating nerves, and that means just creating a gap between two ends of a nerve so that the signal can't cross that bridge anymore. And it's been effective. It's been very effective for many years, but what we tend to see is a revolving door. Patients will get better for a while, and then they'll come back. I'm shifting my practice more towards a regenerative pathway. And what that means is that if you look at the inflammatory cycle, it's the process by which your body draws in repair cells or stem cells into a damaged area and tries to layer down new tissue that's, if not as good as the original tissue, then enough to get you by where it's relatively comfortable. With the regenerative road, what we're trying to do is leverage that inflammatory system to actually push things in the right direction, to get healthier tissue in there, to try to recruit more stem cells, to expose the body to the types of growth factors that do draw in the repair mechanisms, and then leverage that with exercises, with rehabilitation, with stabilizing maneuvers that give the body a better chance at long-term healing, as opposed to just this repetitive pattern of pain.
When you walk into their clinic and office space, you don't see script pads and pill bottles sitting around. You see modern machines and exercise equipment. This may seem odd for pain management, but it's the key to accurate diagnosis and effective long-term treatment.
The interventional equipment that we have, it's all geared toward really understanding the pinpoint origins of pain and how we can rehabilitate the body and how we can get it stronger. Some of that requires, so I use two modes of interventions. One is fluoroscopy, which is an X-ray machine, and that helps me see hard tissue like bone, disc, joints, things like that. The other is an ultrasound, which helps me see soft tissue, things like muscles, tendons, ligaments, nerves. And a lot of pain it's a chronic degenerative state. There's a lot that can happen that can perpetuate the pain.
The key is to understand that pain, especially chronic pain, is not an easy fix.
I do tell people that the regenerative road is not a quick and easy fix. It took years for you to develop this pain. It's not going to take minutes for me to undo it. It is work on your end, and sometimes the pain does get worse before it gets better. After all, pain is your body's way of telling you to slow down, allow this to heal. And we can't just obviate that and expect tissues to still heal and regenerate.